your programs don't have me up first, but I know all the members of the panel, and we kind of talked about it as to sequencing what would be in the audience's best interest. And since I'm an active caregiver, they felt that maybe my coming up first would be best. So, good morning, my name is Helen Medsger, and for the past 25 years, I've been directly responsible for the care of 2 family members with Lewy body dementia. First, my father, and he passed away after 5 years of a very steady decline. And now, my sister, who has suffered with the disease now for over 10 years. And although I'm not directly involved in his care, my youngest brother has also been diagnosed. I'm here today to share not only our many struggles, but our successful strategies for dealing with the disease that the medical profession has termed the most common disease you've never heard of. Back in 1988, my father, Andrew Bundy, was diagnosed with Parkinson's disease. However, within 18 months, his symptoms far outreached the normal course of Parkinson's, and his medical records reflected what the medical professionals referred to as, quote, an unusual phenotype of the disease. The medical, emotional, and financial crisis that enveloped our family and my father's subsequent 5-year decline in a nursing home was my first exposure to Lewy body dementia. The relentless nature of the disease never allowed us an opportunity to catch our breath. And the crazy thing about it back then, no one had a name for it, and the medical community had very little notion on how to treat it. It left us always in a crisis mode. It involved lengthy attorneys' meetings because my parents hadn't put together any estate plan, psychiatric hospital placement because he had become psychotic and violent, and that placement nearly killed him. Med-Cal qualification because the cost of his care far exceeded my parents' financial resources, and the list goes on and on. And after my father's death in 1996, I committed to myself that if ever the opportunity were presented to assist another family with this disease or any other aspect of elder care that I'd spent years researching and applying to our situation, I wouldn't hesitate to do it. But little did I know that that next family was again going to be my own. But this time I vowed it was going to be different. In excess of 10 years ago, my sister Maureen Shaw developed symptoms of what they initially referred to as, oh, it's just menopause. You know, you're in your early 50s, don't worry about it. And then depression. But having seen the onset of the disease before, it wasn't very long before she and I realized that it wasn't what the doctors were calling it. So we went on a path. We sought out the best diagnostic centers in the Bay Area, but it still took 2 years before we received the diagnosis of probable Lewy body dementia. Since then, we've spent countless hours shedding tears and grieving what Lewy has wrought upon us. But at the same time, we made a very conscious decision. We were not going to allow this disease to define her. We had work to do, and it involved staying up on the latest treatment options, attending conferences, participating in research studies, but most importantly, we developed a care plan so that we could fight this monster. So I'd just like to take a few minutes to share with you our short list of our care plan. First and foremost, please designate a health advocate. It can be, I am my sister's health advocate, but it can be a friend, it can be a case manager, someone even, someone outside of the family if necessary. But as my sister's health advocate, and I am also her designated medical power of attorney, I attend all medical and research appointments. We take the time the day before to prepare. We review all of her medications. We also review her current physical, psychiatric, and emotional symptoms while we develop a detailed short list of questions. Preparing in advance keeps the medical appointment on track and facilitates a much more successful Q&A with the physician. They don't want us there an hour. They would like to keep it to 30. So if you can keep it to bullet points, they again will be able to respond to you in a succinct manner. Also, this was one of the critical things I did in the beginning, and it was I developed and I maintain an emergency binder. It contains all of her current medical information, from insurances down to medications, list of physicians, emergency contacts, and all of her advanced directives, including her POLST form. It is available to all critical care providers as needed, and it's taken to every medical appointment. Second, address financial and estate plans. Steve Goldberg is going to cover this topic in a few minutes, but I'd like to impress upon you that it's absolutely essential that this get addressed in a timely manner. Don't wait until your loved one's cognitive abilities are beyond being able to sit down and to discuss the issues. Third, and this one is probably one of the most critical, define while you can a village of caring. Who of your family and friends will be available and willing to assist? And it can be assisting with care, transportation, meals, socialization. I have a friend who had attended our support group, and his old golfing buddies took her husband out, and he just let him sit at the driving range. That can be a gift for the caregiver, to allow the patient to go out and let them enjoy something, give them a few hours of respite. And those needs will change as the disease progresses. So some people may be available in the beginning and others in the advanced stages. And if the family or friend village isn't enough, what other options should you consider? Well, in this community, we have day respite programs. You may need to look at in-home caregivers, whether it be just a few hours or 24/7. Possibly engage a case manager to assist you in planning. Then look at it in advance, the likelihood that you may need to consider placement in either a small residential care facility or a skilled nursing in the later stages. And my recommendation is, please do not take anything off the table early in the process. You don't know, in many cases, what you're going to be presented with, so please be open to change as the disease progresses. Fourth, and Dr. Attree referred to this, it's critical that both the caregiver and the patient maintain social and physical engagement. For Maureen, that meant that we started a regular exercise program, 4 days a week. Although she's no longer able to do the same activities we did in the beginning, we still every day do some level of chair exercises, range of motion, which is critical, and we take walks whenever possible. Now socially, the things that she has enjoyed most all of her life, we continue today. She goes to church on Sundays. She has friends that come pick her up. She still, by the grace of God, sings in her choir. And then she participates in family events and social events, but it's a decision made day to day, depending on how she is. Also, this has been vital to her, music. It doesn't matter whether it's live or recorded, it's a daily constant, and it brings back memories and joys and laughter. So she may no longer know all the words, but she can certainly hum her way through any tune. And as her caregiver, I'm certain that I maintain a regular exercise program and that I take time for my own family and friends. Fifth, this is critical too for both the patient and the caregiver. Have a confidant or a counselor. Along with my sister's neuropsychologist, I am her confidant. She's been given permission to share anything she wants, her fears, her anger, her pain, even her delusions and hallucinations. But I also make certain that I have my confidants. I see a counselor on a regular basis, monthly, and I have for the last 4 years. And I attend a local Lewy body dementia support group. It's critical that the caregiver maintain their mental health and resiliency. And for many, if you don't have either the resources to see a counselor or the time or availability to attend a support group, you have the option of online support groups and forums. They can be very, very helpful. For us, number 6 was really critical. Become a research participant. Not everyone I know will have an interest in research studies, but given our extensive family history, Maureen and I believe that it's imperative and it's critical to us as individuals that we play an active role in furthering discoveries into the root causes of these diseases. So to date, we've participated in over 20 studies along the West Coast. Being this close to the research community really does have its benefits. It allows us to remain abreast of the latest discoveries and cutting-edge therapies. For us, it also includes consideration of brain donation. At the current time, it is the only way to confirm the diagnosis of many neurodegenerative diseases. Why Lewy body dementia has attacked my family, unfortunately, we still don't have those answers. But after years of feeling isolated and alone, we no longer are helpless. Each one of us here today is a caregiver of an individual with dementia. And as such, we must empower ourselves to face one of the most difficult journeys of our lives. We can do this by fully preparing ourselves for the evolution of the disease that we're being confronted with. We can do it through education of the symptoms, current treatments, and therapies. And most importantly, through collaboration with our medical professionals, so that our loved ones' care is not considered custodial, but proactive for as long as possible. Yeah, excuse me. Today, I'm here before you because it's very important for me on a personal level that I be able to share what my family has gone through so that others don't have to go through as many struggles as we have. So if all you do today is take away one tidbit of information or one new connection with either another individual or organization or professional that may improve your quality of life or broaden your knowledge, then my journey with this disease has been worth it. Thank you very much.